Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about vitamin D and how important it is for your health, your immune system, and just about everything. So I had an interesting case come in this week. I've been practicing now for over 30 years and I've seen over 100,000 patient visits, with chiropractic, nutrition, functional medicine, have analyzed thousands of lab reports. And one of the more common things that I see almost everyone that I test is low in vitamin D. They're either below optimal or actually deficient. And we're in South Florida. And this was never more evident than yesterday when someone came in, a 40-year-old guy. He had basically some aches and pains in his hands he'd wake up with, and but overall, thought he was doing well. But when I did lab work on him, he had a number of things that came up. Vitamin D, he was actually deficient, like very low, like really low in vitamin D. And I asked him, well, don't you surf? He's like, yeah, well, how many hours a week? He's out there 4 to 8 hours a week in the sun. He surfs more than that, like early and later when the sun's, but midday, 4 to 8 hours a week in South Florida. And how can he be deficient? Since they say, oh, vitamin D deficiency, it's only an issue if you live up north, and it's only in the winter. So if you live in New York, you're fine in the summer. But the rest of the year, you might be, drink more milk. But anyway, it's ridiculous. Here we are in South Florida. This guy's a surfer. So how is that possible? Well, first of all, what does vitamin D even cause? Well, in his case, he was starting to have metabolic syndrome, which is prediabetes, which can high blood pressure can turn into prediabetes, high blood pressure, belly fat, high triglycerides, high LDL, low HDL. So basically is the precursor to people like aging very rapidly and getting all this belly fat. So that's they call metabolic syndrome. And vitamin D, if you're deficient in that, that's one of the things that being deficient in D can kind of lead to or increase your incidence of is diabetes. Also, depression is tied in with vitamin D deficiency, dementia, MS, Parkinson's, all kinds of neurological disorders tied in with vitamin D deficiency. Fatigue, so a lot of our patients come in almost, with fatigue and generalized aches and pains. Autoimmune, we see a lot of autoimmune patients. Vitamin D is really important for that. Deficiency can affect all of these things and increase someone's risk for them. And skin issues, eczema, psoriasis, asthma, flu. Vitamin D is really important in helping to support and strengthen your immune system, not only with autoimmune conditions, so Hashimoto's, thyroiditis, rheumatoid arthritis. We see a lot of patients with these types of conditions. So vitamin D helps regulate your immune system to help in those areas. And then just the immune system in general, like a study was done a while ago in Japan where they found that taking vitamin D supplements, school children dramatically lowered their incidence of colds and flu over that flu season. So why are so many people deficient? Well, in the case of our surfer friend, I said to him, well, you must use sunscreen, right? Tell me you use sunscreen. So he's like, yeah, he uses sunscreen. Whenever he goes out surfing, he's using sunscreen. So yeah, if you're using sunscreen, then you're not absorbing vitamin D. And so that's one cause of vitamin D deficiency. is not enough sun, but if you are in the sun, using sunscreen is another cause. So should you use sunscreen? Well, getting moderate amounts of sun are really healthy for you in so many ways. So I don't recommend, you want to avoid getting burnt, but certainly a moderate amount of midday sun can be very helpful for you as long as you avoid, like I said, getting burnt. And the other thing is, as far as vitamin D deficiency, well, most foods are really low in vitamin D. So, I mean, if you like cod liver or cod liver oil, you're good. Or you eat a lot of sardines, mackerel, fatty fish, you can get decent amounts. But basically, you got to get sun if you want healthy levels of D. Or most of our patients, myself included, take a vitamin D supplement to get their levels up. The other thing with sun absorption, if you have dark skin, I mean, even for me, I mean, I have an olive complexion, being Italian, so I used to live on the beach and spent at least 2 or 3 days a week for a couple hours. I was on the beach. This is over 10 years ago now, and I was low. And I was severely deficient in vitamin D, and that was one of the things with me, with all the health conditions I had, like the autoimmune and Hashimoto's, things like that, that I was able to clear up. But vitamin D deficiency was a big part of that. And then leaky gut or malabsorption issues. So even if you're taking a vitamin D supplement, like for a while when I started taking 5,000 units a day, my levels really didn't go up that much, and I have patients with the same thing. So the thing is, if you have gut issues, malabsorption, then that can prevent you from absorbing even 5,000 units a day. So what we do with that, you really got to clear up your gut. That's really a sign that there's some issues there. So with all these chronic health conditions we see, clearing up the gut is so important. And that's what I did when I, again, had all these health challenges back a while ago. Cleaned up my diet first, and the diet I spoke to about on past videos that I came up with. It's called the free diet because it's free of not only gluten, but gluten, grains, yeast, sugar, soy, legumes, those foods that are most responsible for inflammation and digestive issues. So I typically recommend for all our patients that come in with these chronic health issues to start with that, to help clear up their gut issues, so then they start absorbing their nutrients, including vitamin D. And if you want I'd be happy to provide a copy of that for you below. We'll put a link below, so feel free to get that. And so other than sun and malabsorption, not getting enough sun, having malabsorption, other things, so it's types of vitamin D supplements. So most, what I find is most adults and teenagers that I test and come back low need on average 5,000 units a day. And children, depending on the weight, but typically averages about 2,000. And I like using vitamin K2 with the D. So one of our supplements says it's D3 5000 with K2, because vitamin K is so important for not only your immune system and bone health, but it helps with absorption of D and getting calcium in the right places. So that's important to take with D. And then we have a liquid vitamin D also for kids or people that don't like capsules. But I recommend that you get checked for your levels of vitamin D to see if there's an issue. Doctors typically don't recommend that, but you can, when you go to your doctor, you can always request that and see if they'll do that. So the lab values are like 30 to 100, but really you want to be between 50 and 70. That's the optimal range. So even if it says normal on the lab, you could be 31, 35. it's really below optimal. And then you start supplementing, mostly, typically is 5,000 a day, I find, until you get in that range, 50 to 70, and then you can back off. It is important to monitor every so often to see how you're doing in that area. The synthetic, oh yeah, so you can also get a prescription for D that's synthetic vitamin D. They typically do once a week. It's like 50,000, but I don't recommend that. It's better to do daily instead of once a week. And the natural, which is D3, is much better than the synthetic version, in my opinion. So I would just steer clear of the D2, which is the synthetic version. Let's see if there's any other issues. I think we pretty much covered all of that. So if you are having any health issues, whether any chronic health issues, whether it's aches and pains, brain fog, autoimmune conditions, thyroid conditions, anything like this, I mean, this is, again, one of the most significant and common deficiencies that we find, and it can be so helpful in helping you turn your health around. Just one small piece in getting to the underlying root cause of your health condition and then turning that around. So if you know someone that could benefit from this, feel free to share it, and so you can subscribe to my YouTube channel, leave any comments below or any questions, let me know. And again, if you want a copy of the free diet, just click on that below and we'd be happy to send that to you. Thanks for joining me today and look forward to seeing you next week. Take care.